Welcome to Your Anxious Child, 5-Minute Solutions, a podcast dedicated to providing practical advice and support for parents of anxious children. This advice is informational in nature and not a substitute for a consultation with a licensed mental health professional. And now, here's your host, Dr. Edward Plimpton.
Welcome back to Your Anxious Child, 5-Minute Solutions and Interviews with Experts. Today, we have the good fortune to talk with a pediatrician. And this is the kind of first time we've had the luck to talk to a pediatrician. But pediatricians are in a unique vantage point to help us understand anxious children and the context in which parents are raising children. Dr. Kristen Cook has just written a book, Parenting Redefined, a guide to understanding and nurturing your child's behavior to help them thrive. And it just so happens she also has her own podcast, Mom Doc Talk, in which she covers many topics. And I would strongly recommend that you check out her podcast as well. So, Dr. Cook, thank you so much for making the time to talk to us today. And perhaps you could just tell us a little bit about yourself.
Sure. So my name is Kristen Cook. I am a pediatrician with over 15 years of experience. My practice is in southeastern Wisconsin. I also am blessed to be the mom of two wonderful kids. Mason is 13 and Savannah is 10.
Great. So I was particularly excited to have a chance to talk to you today because, professionals who work with children each have their own vantage point in which they can see children. Teachers have the advantage of, with their particular class, being experts on what third graders look like. They've got 30 plus and they have them for the entire year.
Mhm.
So they have a certain kind of perspective and vantage point that the other of us don't have. And in many ways, I feel that in order to understand the residual effects of the pandemics, frankly, teachers are often the best source of information with regard to that.
Mhm.
Psychologists such as myself have the vantage point of knowing a few children intensively over time. And that provides in which we get to know the child and the family very well.
Mhm.
Pediatricians have a decidedly unique vantage point. In contrast to teachers and psychologists and other therapists, they have experience with babies
Mhm.
and they follow children throughout their lifespan. And they see lots of children. So it's an expansive overview that the rest of us don't have. And they get to see how a variety of problems play out over time. Strikingly, also from my perspective, it's this familiarity with early childhood that I think is also quite distinctive. Even psychologists such as myself don't always have, except for their own children, a lot of experience with infancy and small children. Although actually I am an exception with regard to that. But in any case, so so Dr. Cook, I would be just hoping we could take advantage of your perspective and just begin with a a general question. From your vantage point, do the surveys that repeatedly show that children are experiencing a mental health crisis, that, adolescents, maybe 20% of them are suffering from an anxiety disorder. Does that ring true to you? And, what are you seeing in the context of your work?
Of course, absolutely. When I first started my medical practice over 15 years ago, it was incredibly rare for me to treat a patient with an anxiety disorder. It whether it wasn't as common or wasn't as recognized, I just didn't do it very often. And these days, almost every single day in my medical practice, I am helping to medically manage a child that has been diagnosed with an anxiety disorder.
What's the range of issues and challenges that you encounter?
It really depends on the child's age. Um, Especially the school-age children and the teenagers. I think this technologically driven world that we live in, where because of things like social media and the internet, there is no privacy. They can have an interaction that they don't even remember, but somehow becomes viral on social media, and it can be devastating to them.
So, what sort of things do you kind of run into that are particularly kind of devastating for these kids?
Yeah, and again, it depends on the age. It
Hmm.
depends on the background. I work in an underserved community, and there are a lot of children that from a very young age experience a lot of trauma, whether it be the death of a parent, being placed into foster care, um, being exposed to drugs at an early age, those kinds of things.
So, technology. Um, what is your kind of perspective in terms of the effect of kind of technology on children?
Yeah, well, you
And
could
what
get
and what's the guidance you give parents about it?
yeah. So there are more and more studies coming out indicating that the use of electronic devices actually has an effect on the developing brain. The human brain doesn't fully develop it till a person is in their mid 20s, and then it continues to grow and evolve after that. And I am not familiar with the specifics of those studies, but there's a real concern that excessive use of electronic devices rewires a child's brain.
Right. In fact, a previous podcast with Maria Swingle, who has studied kind of EEGs with um, both people who are internet addicted and also, a number of children, has found that um, there are definitely kind of changes in kind of EEG, patterns with children and adults who engage in excessive internet use.
Yeah, absolutely. And there are also some very good studies out there that are demonstrating that excessive use of social media in teenage girls is a risk factor for both depression and anxiety.
So it seems potentially very challenging to address these issues, I am imagining, in the type of practice that you have, which serves underserved community.
Mhm,
Because, I certainly encounter kind of children who they come home from school and they just are playing games, on their computer for hours.
mhm,
And they have a mom who cleans hotel rooms in a local Holiday Inn, and she's not going to get home until 8 o'clock.
mhm,
And they don't necessarily have the safest neighborhood to kind of go out in.
mhm, mhm.
And it strikes me as a real challenge in terms of, you know, how to kind of help this child and this family. And be curious about any kind of thoughts you have about that.
Yeah, it's incredibly challenging. I think the first thing that parents need to do is give themselves some grace. I have a lot of families in my practice. They didn't decide when they were growing up that they wanted to work 3 jobs simply to support themselves. That's just the life circumstance that they happened upon. So, again, parents giving themselves some grace, but also trying to set limits when a child is young. so that as they grow up, they can understand what the rules and the boundaries are related to those electronic devices.
Yeah, it's just so challenging when these parents have to work long hours and, maybe there's an older sibling in the house, but um, it's just very challenging.
It is very challenging. And one of the ideas that I provide with my families in my medical practice is create a family electronic drop box
Mhm.
and have very clear set hours that those electronics can be taken out of the box to be used. And if those electronics are not in the box when they're supposed to be, then that there's consequences for that.
Mhm. Yeah. Um, yeah, absolutely. Um, I would be also interested in your vantage point. The whole issue of vaccines has, you know, basically come under attack,
Mhm.
and parents um, are questioning the advice of pediatricians, and they are picking and choosing. If they're not, I, I think in general, total anti-vaxxers are a small number. But I think a larger number of parents are picking and choosing the vaccines that they do. So they're not really kind of going with the schedule. So I would be interested in your kind of thoughts. First of all, a reminder about why vaccines are so important and the issue of safety and kind of recommendations about that.
First of all, I think it's very important that people ask questions related to vaccines. I don't think that it's a good idea for any parent to accept any medical treatment blindly without understanding where the recommendations for that treatment or medical intervention come from. Regardless of the misinformation out there, it is scientific fact that vaccines save lives.
Mhm.
And that fact, despite people's beliefs, cannot be disputed. And so what do we do with that information? Okay, vaccines save lives, but yet there are still people out there that are hesitant to give their children the recommended vaccines. Okay, so let's understand that hesitancy.
Mhm.
Let's have conversations about the parents' fears and the parents' concerns. And let's help families break down the misinformation because it is so rampant when it comes to vaccines. There is so much misinformation out there. The idea that the MMR vaccine causes autism was debunked decades ago. And there are still families in my office that come to me and say, Dr. Cook, I'm concerned this is going to cause autism in my child. And so it's important to have those open conversations without judgment so we can understand where the hesitation comes from and hopefully to provide reassurance that those fears really are not what we're seeing in the real world.
In addition to kind of um, autism, are there other kind of common misconceptions that you encounter?
Yeah, the biggest one is that the influenza vaccine causes the flu. The
Uh-huh.
influenza vaccine that is given as an injection is a killed vaccine, which means that it does not have any ability to cause illness. Only live vaccines can potentially cause illness and mild illness at that in a person.
Okay. Okay. Have um have you developed any techniques or tricks to help with children who are, let's just say, needle phobic?
Yeah. Oh my gosh. Okay. So,
Uh,
needle phobia occurs in about 30% of young adults and up to 10% of adults. Um, the medical term for it is trypanophobia, and it can involve extreme anxiety related to injections. It can involve increases in heart rate. It can involve dizziness, lightheadedness, even to the point of having syncopal episodes or passing out. So this is a very real thing, and we deal with this on a regular basis in my medical practice. And a lot of these fears come from past traumatic experiences with needles.
Hmm?
And so it's important to understand that a child who is resisting a needle of any kind is not necessarily trying to be defiant. They're scared. They just need some help processing what is about to happen to them. So, in terms of interventions, it really depends on the age of the child. You know, talking about a vaccine to a 4-year-old is very different than talking to a vaccine to a 16-year-old. One of the things that can be helpful is just watch your wording. Instead of saying a shot, say, you know what, we're going to give your arm a little pinch. Sometimes that can be helpful. Some facilities are lucky enough to have numbing sprays or creams that can be applied to the child's arm before the injection is given. In older kids, it can help to give them some autonomy, such as, hey, what arm do you want us to use? So those are some of the strategies that we use in my medical clinic.
So I wonder if I could just kind of ask a more detailed follow-up question. Broadly, I see sort of two classes of kind of children who are um, needle phobic. One is the child who's held down to get a kind of a vaccination when they were 3 or 4
Mhm,
is one group. That's a express route to kind of develop kind of a fear.
mhm.
Uh, and then the other group is are ones who have had a chronic medical condition that have required multiple kind of blood draws or vaccinations, whether it's, um, one of those unusual kidney disorders or a heart condition or whatever. And then, at 9, 10, their bodies just react. And I wonder if you have any kind of thoughts about and whether you would agree with those two broad
Yeah.
categories.
Absolutely. So, in terms of the 4-year-old that has a traumatic experience because they were held down and forcibly given an injection, one of the things that parents can always request, and it may not always be possible, but a parent can always request at the 4 to 5-year-old age range, hey, can my child sit on my lap while you administer this vaccine? Because that physical comfort that a parent can give can be very reassuring to the child. It doesn't necessarily mean that the injection is not gonna hurt, it's still gonna cause discomfort, but at least they're emotionally supported in that situation. For the child that has a chronic medical illness that requires a lot of IVs or shots or medications, it can be really helpful, again, to give them some type of autonomy, you know? If possible, "Hey, what time," for let's say a child is chronically hospitalized. Yes, many of these medications need to be given within a specific time range, but, "Hey, let's work together. What time do you think? Again, what arm would you like to use? Do you want to hold a stuffed animal while we do this to you? Do you wanna hold mom's hand while we do this?" So, really communicating with the child and respecting to the degree that is medically able their preferences.
Yeah, I totally agree. Yeah, in the kind of practice I work at, often suggest that parents look at the Meg Foundation, um, which is I think a really good kind of source of information about kind of pain management for kind of pediatric patients, and with a lot of kind of detailed instructions about developing kind of a comfort plan and the like.
Mhm.
Um, so, um, one thing that has um, unfortunately kind of happened over the past 10 or 15 years is programs that have been designed to help children with medical kind of being in the hospital, stuff like that. We're known as child life programs.
Mhm.
have been basically defunded,
Yeah.
and or the programs have had to kind of cut back. And of course, that varies by kind of location and stuff like that. But as a result, there, in my opinion, has been a kind of a decline in really helping prepare children for, medical procedures, and whether it might be an EEG or it might be um, um, getting infusions if you've got Crohn's disease, or any number of them. And of course, whenever anything is done to your body, there's going to be some level of anxiety. And I wonder if you have any kind of thoughts about how we can kind of help children with these kind of ongoing kind of medical issues, or how do you
Yeah.
do it in your office?
Yeah. So when I was doing my residency years ago, there were child life experts throughout the hospital. There was one stationed in the emergency room. There was one that used to float to different floors of the hospital. And these medical workers really provided an essential skill. And unfortunately, again, because like you're saying, because of budget cuts, these programs are starting to be eliminated. So, for example, when I was working in the emergency room, every time a child came in that needed stitches, the child life coordinator would go into the room and sit with the child and, in developmentally appropriate terms, discuss what was going to happen before it happened. And one of the things that I have taken into my own practice is we call suture material magic strings, because stitches can sound really scary,
Uh-huh.
but magic string takes the sting out of it. And so that's one of the principles that I have carried into my medical practice, both when we're putting stitches in and taking them out. But it can, that can apply to broader things as well. A child who's getting an EEG, in age appropriate terms, someone really should be explaining to the child what's going to happen to them. In the past, it had always been the child life specialists. Now we've got to find creative ways to include this, whether it be the nurse, the technician, the physician. We've got to find a way to talk to these kids about potentially traumatic medical procedures before those procedures happen, because that might minimize the trauma.
Oh, absolutely, absolutely. No, I think it's kind of a challenge for all of us in terms of um, because when we don't, often downstream, there's greater resistance to medical help. There's kind of procrastination in terms of making appointments,
Mhm.
and the like. So,
Yeah. Yeah, and I will say in my medical practice, and this is just anecdotal evidence, but the 10, 11, 12-year-olds that have the biggest emotional reactions to finding out that they are due for a vaccine are the same children when they were 4 or 5 that their parents would be very harsh with them when they got upset about needing a vaccine. "Don't cry. It doesn't hurt. It's not that bad."
yeah.
Whereas I've noticed with my own kids, as they got a little bit older, I would always prep them before they needed a vaccination. And to this day, my kids have always, they might not be happy about it, but they have always sat and just received the vaccination without a fuss. And I don't think I'm doing anything special. I think it's, again, what we're discussing is preparing these kids for these potentially traumatic medical events before they happen.
No, I agree. I think um, I've seen with my kind of grandchildren, my daughter has, you know, really encouraged a lot of kind of medical play with them, and they and they spontaneously kind of do it after visits with their pediatrician, and they're able to do it without difficulty.
Yeah.
Um, and my grandson, had to have a blood test, and he was, 2 at the time, and he just kind of sat there and looked at the needle, and and he was good to go.
Yeah.
And I think it was a function of, a lot of play.
Yeah.
To
I would
kind of
I would absolutely agree. The younger kids, they might not respond to a discussion about what's going to happen from a medical perspective, but certainly playing, using doctor kits, getting dolls, and kind of role playing the scenarios, that can be so incredibly beneficial for younger children.
so one of the additional areas where you have a unique vantage point is dealing with, children who have kind of chronic medical kind of conditions.
Mhm,
And I think it can have, there's several phases to that issue. One is kind of the immediate kind of response of during the kind of crisis moment.
mhm.
Um, and then there's the kind of after effect in terms of, the residual effects of having a child with a chronic kind of condition.
Mhm.
And wonder if you could kind of give us, kind of some thoughts about that, because it's not necessarily a topic that gets, you know, a lot of kind of discussion.
Right, well, and, when people are dreaming of becoming of parents, they typically don't consider, "What if my child has a chronic medical condition? What am I gonna do? What are we gonna do?" And I think it's important whenever someone is given bad news about a medical condition that their child has, it's very important for the entire medical team to be understanding that that family will probably be in shock, and they will probably not retain a lot of the information that you tell them. And it's very important to be understanding of that and accommodate that. You may need to repeat yourself multiple times. It can be very helpful to give your instructions and the information that you are providing to this family in crisis written documentation of everything that you are saying so they can take that with them and when they are able to process it at a later date. So, and I unfortunately I've diagnosed patients with cancer, I've diagnosed patients with type 1 diabetes, I've diagnosed patients not necessarily with Crohn's disease because that diagnosis typically comes from a gastroenterologist. But it's very, very important to watch what you say and say it with love and the kind of from the standpoint of, I am here to guide you through this as your child's pediatrician. At least that's my perspective on things. So again, in the initial crisis, just be careful about how much information you're providing. And just know you're probably gonna need to repeat that information, and parents, please, if there is something that a medical provider is telling you that you don't understand, do not let that provider leave your side until you understand what they have just told you. It Don't be embarrassed, I get caught up too, just like any other physician. It Medical jargon is almost a different language. And so it's really important to stand up and say, "I'm sorry, I didn't understand that. Could you say that in a slightly different way?" And a good medical provider will not get upset with you for that. In fact, they should sit down and explain it again in different terms.
Well, if the adults kind of listening, just recall how much information do they retain, or do they retain all the information they have when they just go see their primary care physician? I would venture to say that even if we're not kind of clearly anxious, the amount of information we often find ourselves forgetting or not retaining all of the information just in normal visits that
Mhm,
we have as an adult.
mhm.
I'm guilty of that.
Sure.
And and then we take it into the supercharged area of your child and something um, that's really a risk. You know,
Yeah, yeah.
So developing so how how can parents be effective partners with their pediatrician?
Yeah.
How
So,
can
one of the things that I always tell families is I may understand medicine better than you, but you know your child way better than I do. And I'm here to work with you and partner with you to provide the best medical care possible for your child. And I think that if a physician is not willing to take that kind of standpoint, maybe they have a little soul searching to do, quite honestly. So that's the initial approach that I take, and then it's it's really important just to listen to people and understand what the parents' goals are, especially for a child with a chronic medical condition. What are your goals for your child? How can we work towards those goals? What additional information do you need? That kind of stuff.
one of the ways, in my opinion, that um, parents can work effectively with kind of any medical provider is being able to describe symptoms clearly.
Mhm.
And I wonder if you have any kind of suggestions about how we can help parents learn how to describe symptoms in a way that is helpful. I mean, it was a problem. I mean, for me, when I brought my child into the pediatrician, um, I would have my wife review all of the symptoms, and I'd write them down on a little card,
Mhm.
and I'd bring them in, and I'd kind of sneak the little card, in front of me, as I was talking to the pediatrician. And I can remember doing that with actually the pediatrician who eventually hired me in the practice that I work at right now with my kids. I'd have my little kind of cheat card,
Mm.
with that because I wasn't going to count on myself to kind of remember things clearly.
Yeah. I have patients to this day that do the same thing. And I think it's wonderful. Sometimes the most knowledgeable parent isn't able to bring the child to the appointment. So any additional information that can be provided, even if it's on an index card, is a great thing. You know, a lot of my patients don't talk because they're so young, so they can't tell me what's going on. And that's one of the things that I love about pediatrics is that if somebody can't tell me what's wrong, I have to figure it out, and I love that intellectual challenge related to my career. But one of the things that parents can help do is what I do in my office all the time. Say I have a kid that comes in with abdominal pain, and I say, "What does it feel like?" Well, a lot of times they'll say, "I don't know." Okay, that's fine. But let me give you some ideas. Is it stabbing? Is it throbbing? Is it like somebody's punching you? Is it like somebody's squeezing you? So, using those descriptive terms can really help with any kind of symptom.
Mhm. What let's kind of turn to for a second the book that you just published, and congratulations.
Thank you.
Tell me your thoughts about what led you to write the book and what were you hoping to achieve in writing your book?
Yeah. So, over the course of my career, I have realized, and actually very early on in my career, I realized that a lot of the questions that parents were asking me didn't actually have to do with anything related to pediatric medicine. It had to do with parenting.
Mhm.
How do I manage my child's temper tantrum? What do I do if my child is hitting? Why won't my child stop back talking? Why are they lying? Those are things that I didn't necessarily learn in medical school, but I took the time to get continuing education in. And over the years, parents have had the same struggles, regardless of their economic background, regardless of where they live, regardless of their education level. the themes are pretty consistent. Temper tantrums, back talk, eye rolling, not wanting to get school assignments done. And I thought, my goodness, if over the past 15 years, parents in my medical practice are having these issues, parents all over the world must be trying to navigate the same things. And I have acquired the knowledge to help parents address some of these issues in more peaceful and effective ways. And that was really the impetus behind the book was my own patients.
Well, I did notice as a child psychologist, I was pleased to see that you included Jean Piaget,
Mhm. Yeah.
Eric, um, who does not always get the attention he deserves.
Right.
Eric Erickson, whose books actually has staying power in a way that few other people's don't. And then, interestingly, with regard to kind of play, Mildred Parton.
Yeah. Yeah.
Uh,
And a lot of people, they're quick to say, well, these are just theories. Okay, but theories, when applied to real life, can have tremendous influence.
oh, yeah, absolutely, and can give you. I mean, for example, Piaget and his kind of theory of cognitive development gives gives a way of understanding how gives us a handle on how children think about the world in different terms.
Mhm.
Um, they're in a way cognitive aliens, as one person kind of once put it, and that's an extremely kind of helpful kind of perspective in
Mhm.
terms of being able to communicate with kind of children that they really understand the world differently.
Right, they do, and it's so important for parents to try to look at the world through their child's perspective, especially when it comes to trying to understand their child's behavior or implementing effective discipline strategies.
Mm. Yeah. And so tell us about your hope behind your podcast as well. Um, and
Yeah, so
what you're hoping to achieve in your podcast, which,
yeah.
by the way, I like the succinct to the point quality of your podcast. There's not a lot of idle chatter, which frankly with a lot of podcasts can be a little annoying.
Yeah, sure. Yeah,
When you're
yeah.
so please.
So the goal really is to provide parents with brief 15 to 20-minute, um, information sessions about a particular topic, whether it's, "Is this behavior normal for my newborn? How do I manage temper tantrums? How do I talk to my kids about vaping?" It's supposed to be very short, not overwhelming, intense focus on a particular topic that a parent can listen to while they're driving their kids to school. It's I created the podcast when I thought about, gosh, when I first became a mom, what would have helped me the most? New moms, they might not have time to read a book. They might not have time to listen to an hour podcast with an expert, but I bet they can fit in a 15-minute episode somewhere throughout their day. And that's really where the driving factor behind my podcast came from.
Well, it's certainly kind of needed when we kind of think about how isolated kind of parents can be,
Yeah.
that, without having kind of an extended village that, new parents are, with their new baby they're not gonna kind of know that new baby isn't gonna poop solid poops and it's gonna look like diarrhea. But if you don't know that, you're thinking, oh my God, my new baby, my baby's got diarrhea. What am I gonna do?
Mhm. Yeah.
And so having kind of information like you have on your podcast is obviously extremely kind of helpful in, how should we say, enlarging the village.
Thank you. I hope so. I would love to just be another voice, another sounding board for parents.
Great, great. Well, we're just about out of time. I think, is there any kind of closing kind of comments that you might have for our audience? Or
Yeah, I just, especially for the parents of children that are struggling with anxiety, please don't blame yourself. I have a lot of parents in my medical practice that come in and say, "Dr. Cook, my child has anxiety because I have anxiety." Well, it's more complicated than that. So please don't blame yourself. And even if you're not dealing with an anxious child, if you are listening to this podcast and you are a parent, you are doing a good job. People that don't care about their parenting skills don't listen to podcasts like this. So please give yourself some grace. Maybe find a way to pat yourself on the back a little bit. I had a mom the other day that came in and said, "Dr. Cook, I'm failing my child." And this child was well cared for. She was smart. She was meeting all her developmental milestones. She was growing appropriately. And I told the mom, I said, "I want you to write down a list of all the good things you've done as a parent." Because we tend to focus on the negative. We tend to focus on the things that we're doing wrong. And I just want parents to know that they are doing better than they think.
Absolutely. Absolutely. Um, and they're dealing with some powerful kind of issues in our society that make parenting such a challenge, such a challenge.
Yes. Mhm.
So, so where can people find out more about your work?
Yeah.
And we'll put them in the show notes, but I'd love for you to kind of tell where they can find more about your work.
Well, thank you. So my website is www.kristencookmd.com. The book Parenting Redefined: A Guide to Understanding and Nurturing Your Child's Behavior to Help Them Thrive is available on Amazon. And my social media handles are usually momdoctalk, MOMDOCTALK
Great. Well, great. Well, thank you so much for carving out the time from your busy schedule to talk to us today.
This was a pleasure. Thank you so much for having me.
Thank you for listening to Your Anxious Child. Please leave us a rating and review in iTunes to help us get the word out. If you'd like to learn more and find additional resources, visit us at edwardplimpton.com.